Hey everybody, welcome to Meddkit's Provider Spotlight, where we are interviewing the most amazing private practices from all over the United States. And every week we come with someone new, a different industry, very fun, very educational. But today we have an awesome special guest. We have Mary Beth, and she's actually the director of Integrative Care at Reclaim Dentistry. Mary Beth, welcome. Thanks so much for
Thank
joining
you.
us.
Thank you for having me. It's a pleasure to be here.
Yeah, excited to kind of get into things with you. So I would love to
Yeah.
hear your story. I typically start out this way. I think it's nice to tell the background. How'd you end up at Reclaim? And, what do you love most about being the director of integrative care?
Yeah, I'll give you the shortened version. My story is a interesting and unconventional one. I have a degree in architecture, and so when, people hear that, they're like, "How did you make it into dentistry?" And ultimately, it lies at the heart of, what we believe patient care is, being human-centered. And I did learn a lot about, what it means to design and, put the person first in all of that. And I knew that I wanted to carry that into whatever I did, but didn't. I knew that I wanted to not be an architect at that time. I ended up taking a temporary position at an airway-focused orthodontic office after I had finished my degree and everything. I ended up staying there after realizing how much life-changing work is being done in the industry, and seeing how I could contribute to that in a few different key ways. But I did some lab work for them, and I was helping them, streamline processes within the office, and just fell in love with what was being done. And I stayed there for a while and ended up meeting Dr. Kevin Schwant at a course that was being hosted at our office. And I was also looking to leave my home state of Arkansas. I'd
Ah,
been there really my whole life and, wanted to get out. And it was a great opportunity to, see the work that was going to be done out here. Ended up moving and then being employee number one and helping Dr. Kevin start this office. So,
that is so awesome. I love you just 360'd your whole entire
yep.
career and moved, and that's so awesome. I mean,
Yeah.
really neat accomplishments and really cool to take charge of what you saw and you loved and your passion and you went for it. So kudos to you. I think that's
Thanks.
great.
Thank you.
So kind of heading into Reclaim, like what do you guys, most often see? What are the most common
Mm.
areas that you're treating, you find people are just really struggling with?
Yeah, so, in our office we focus on, looking at the whole body as it relates to teeth. And we also do a lot of, you know, bigger, higher level treatments that are changing things on a much bigger scale than your typical traditional dental office.
Right.
And so some of the things that we deal with on a regular basis are like systemic issues that people come in with, and they haven't been able to figure them out, treat them, come up with solutions. And so um, a lot of systemic issues that people deal with and chronic illnesses actually can be stemming from dental issues and vice versa. Like, people are having dental problems and they can't get rid of it. And it's because of a larger systemic issue. And so that's really the balance that we deal with the most. And I personally deal mostly with, especially in these early years of the practice, I've mainly been working with patients seeking answers regarding sleep and breathing issues. So as those pertain to the structure, function, and behavior of the airway, the mouth, and the jaws. And so those are really the main things that we're looking at, even though they're pretty broad in scope. So
Yeah, I think there's a lot more that meets the eye.
mhm.
Some people are like, yeah, braces, and you're like, not the whole story, okay? There's
Yeah,
so much
yeah,
going on.
exactly.
Yeah, so it's really
Exactly.
great to hear the summary of, what you guys are really finding to be, those problems, but common, but also sometimes not widely known. That's something that
Right.
you can treat and deal with. And in terms of your approach, how would you say you guys are different? Like I mean, you're bubbly, I mean, you guys are on top of it. Aside from that, but like, what would you say about patient care? Like, what's different about your practice?
Yeah, so I think traditionally when people think of a dental office, they think, okay, I'm just going to get my teeth cleaned. If I have a cavity, I'll get it filled. And if I need braces, I'll get braces and my teeth will be straight and everything will be fine.
Yeah.
And there's just a larger picture. People are really complex and unique. And so, our approach is really focused on, not just treating teeth, we're treating a whole person. And, in that, we're invested in understanding someone's issues from a whole body perspective, and overall wellness perspective. And part of that includes, diagnostic processes that are extremely thorough, so that we can ensure, the best, most predictable and successful outcomes possible. Um, in addition to that, we also recognize that the ways of doing traditional dentistry aren't always in the best interest of the patient. If you think about just the ways that you're a lot of the times shuffled through a dental office of and just oh well, you need a cavity, and then that cavity needs to be filled, and then that tooth's going to break down eventually. You need a root canal, and then you need a re-root canal, and then you need to get the tooth extracted, and then an implant. And it's just like there's like a pathway that I think a lot of people get put on, that's not always exactly what they need in every step. And so just ensuring that, what we're recommending and what we're having people undergo is what they actually need is a big part of how we approach things.
No, I like that. It's a good conservative approach. Yeah, I think a lot of people come in, I'm sure you get questions, which kind of leads into my next thing. You know, oh, I came from so and so's office and they said I needed like the works. And you're
Mm,
like, well, maybe that's not the best for you. And I like that we're only providing what you actually really need. And
mhm,
we want to do that in the best way possible. So here's what we recommend. And so I like that really holistic approach,
mhm.
but just also that conservative approach as well, which I think makes people a lot more comfortable,
Yeah,
when you put it that way. But kind of
yeah.
the next thing, I think, you know, kind of like what we talked about before, there's a lot more that meets the eye. In the day of also the internet, Dr. Google has a lot to say. ChatGPT formulates, answers on the ready for
Mhm.
you. But it doesn't replace a doctor and it doesn't replace the knowledge that you have, and sometimes can also be harmful and not correct. So, what would you say are the things that you guys are constantly debunking? What are like the misconceptions that you feel like you're being a broken record about and just debunking all day long?
Yeah. Yeah. I think it does like go back to the idea that, treatment, as people are unique, treatment should be unique. And so things aren't one size fits all, right?
Yep.
Even with the people that are invested in the way that we are doing things, sometimes we'll get people coming in and being like, oh, well, my friend had this done, and so that's what I need because it's, different than what I've heard elsewhere. And I think this is my answer. And it's like, ooh, you're on a great path of finding that, you might, you know, you need to be looking in other places for, your answers, but that person's different than you. Your friend is different than you, and what you need, you might see similarities in your experience, but you need somebody that's trained to look at these complexities and understand how to approach them in a really, again, successful and predictable way.
Yep.
But also, like, besides them not being one size fits all, I think there is a misconception about, um, and a really negative perspective of holistic practice being so conservative that you're compromising high quality.
Mhm.
And especially in the dental community, I think that's a big misconception. And, we're actually striking an incredible balance between, you know, having something be conservative and holistic in nature, but also being like part of the most high-tech innovation
Yep.
that's available right now. We're doing some extremely advanced work that is holistic, but really what that means is that it's working with the body to help the body heal what it needs to, and in the way that it can, when given the right tools for it. So I think those are really the two big misconceptions is that there's one way to do anything and that holistic equals not so high tech, or advanced.
Oh, I like those answers. This is why I love doing these interviews because everyone, even if I talk to someone in the same specialty, they always have a different answer. They always have something new to bring to the table, a new perspective, something else to debunk for us that is like, psh, light
Mhm.
bulb, just things that you wouldn't think about. So I love that you had brought that up. But yeah, I can understand the questions you might get about that, especially, oh, I have a friend, very similar experience, or, looking to get the same kind of thing done. And you're like, yeah, you're gonna have a very different experience because maybe your
Yeah.
teeth are not structured obviously in the same way, or your
Mhm.
jaw, or whatever that might be. And then
Yeah.
yeah, you're not gonna have that same human experience as she might because
Yeah.
you're a different person.
Yeah. And to that point too, people often find us and find the things that they do need
Yeah.
because of similarities with other people. And so I think the biggest, most important thing is that the conversation's open, right?
Yep.
Where people aren't coming in with a tunnel vision, where we're not approaching them as providers with a tunnel vision of what is just going to need to be done. Oh, well, I've seen somebody like you before and you just need this. I
Yep.
think the conversation has to be much more nuanced. And I think that's really what we bring to the table in terms of patient experience and also successful outcomes.
Cool. Awesome. And kind of what I love to do is, if someone could wrap up this video in a bow, and one thing that you wish either patients or whoever could take from it, like what would it be? So, like, what are some maybe few easy tips or homework that you love for people to do, whether it's before coming in the office or maybe something that you should do at home to, better their health for the future? What do you wish those things would be?
Oh man, there's a few. I think number one, ooh, well, from my department in airway, sleep, and breathing, I think number one is establish a nasal breathing habit. It's not something that we've really talked about much in our conversation yet, but there's a vast realm of airway, sleep, and breathing, and the way that we deal with it is very systematic in approach, and it's huge and complex, and I can't go into it, but nasal breathing is a huge, important part of our overall wellness, and not often talked about in
Yeah.
healthcare spheres, and so um, we're on a mission to treat that problem from both a habit and behavior perspective, but also a structure and function perspective. It's not always possible for somebody to breathe through their nose efficiently. And so, that's hard, but at least, trying
Yeah.
and is a huge part of health. And if you can't, then start trying to understand why. Because I think, without going into a lot of detail, there's a lot that people could do to benefit their lives by just starting to ask those questions. And then also, brush your teeth twice a day at least. Floss, please. It prevents so much more than just cavities between the teeth. Um, and eat well, eat foods that nourish your body. Our teeth are ultimately tissue, and they're alive and they have a blood supply just like the rest of us. And so, treating them well and giving them nourishment in the way that they should be nourished is huge.
Yeah, I love that. Something that you said that I feel like is really understated that people don't think about enough is just asking the questions,
Yeah.
noticing. And I think people don't do that enough. And so I love that you said that because we think sometimes pain is normal or, we just, oh, we'll take care of it whenever, blah, blah, blah. Life's crazy. But I love that if you can't figure out, about talking about the, nasal breathing is just, you know, hey, if you can't even do that, you need to start asking yourself why and get down that rabbit hole first, right?
Yeah.
So I
Yeah.
love that's your approach. That's really, really
Yeah.
awesome. Ask the
Ask the
questions.
questions. Yeah.
Ask the questions.
Yeah. It's like when I start telling people, being tired all the time, of course, makes sense in our, current hyper stimulated
Yeah.
mode in society. But it's not normal. While it's common, it's not normal. Being tired is not normal. Having poor sleep is not normal. Getting up in the middle of the night and not being able to sleep is not normal. Like these things are often common, and a lot of things that we deal with in a dental way too are common but not normal. And so yeah, asking the questions I think is the way to better your life and better your overall health.
I love it. With that all being said, this was amazing. Thank you so much for joining us, Mary Beth. But before
Absolutely.
we take off for today, can you tell us, where folks can reach out, where they can get more information from you guys? Internet's an awesome place, and I'm sure you guys got a lot going on. So would love to hear
Yeah.
more about where people can find you.
Yeah. Right now, the best way to find us is through our website, reclaimdentistry.com. Um, And I think in the coming months, we'll be seeing we'll have some appearances on social media. So stay tuned for that. Or call our office. We're always available to answer questions. We offer complimentary consultations for a range of inquiries. And so, yeah, one of our main goals is to educate and to provide information that we think is really necessary for people to live their best lives. So, any of those paths, but probably our website.
Awesome, perfect. And
Yeah.
we'll link that in the description. So, guys, feel free to head over to their website and check them out. Get more info and reach out if you have any additional questions. Thanks so much, Mary Beth. Appreciate
Thank
your
you.
time.
Absolutely.